Test, test. Mic 1-5, test. Mic check 1-2. Mic check 1-2.
Good afternoon, everyone. Let us pray. God of mercy, grace, and justice, we thank you for the opportunity to serve. Please lead us to speak with thoughtfulness, to listen with understanding, and to act with clarity and conviction. Renew us with the strength of your presence and the joy of growing the JPS Health Network in a way that is always worthy of any and everyone. We place our hearts and minds in your hands so that you may direct us. Amen.
Please join me for the pledge.
Stands one nation, under God, indivisible, with liberty and justice for all.
I'm still waiting for the for all.
It's not often that we get citizens wishing to address the board, but we have several today, and I'd like to welcome them here today. And just before we start, lay out a few of the ground rules, mainly for the board because, you know, it's been a while. So anyway, each speaker will have 3 minutes to address the topic, and we ask that you remain respectful and refrain from using inappropriate language. Board members should refrain from responding to your comments, so we're not being rude. We're intentionally not responding to avoid accidentally venturing into subjects that are not properly before the body. We won't respond to any non-agendized matters today, and we may consider taking up your matter on a future agenda. We ask that you please not mention any specific patients and come to us as a board, not individuals here or individual staff members. We're one JPS team. With that, I will ask Nan Terry to come up and speak with the Justice Network of Tarrant County. Thank you.
Thank you. We've been concerned about deaths in the jail for several years. We have spoken at board meetings for MHMR, and we speak regularly at the Commissioner's Court. We would like to meet and discuss with the board and staff in greater detail our concerns and suggestions over and beyond our public comments of 3 minutes. But we do not wish to blame anyone. Our goal is to limit the deaths in the jail. And I want to remind you the vast majority of inmates detained in the jail are pre-trial, which usually means they are too poor to make bail. I'm briefly going to mention our suggestions. Others will go into detail. We encourage you to implement the recommendations from the Critical Incident Response Team Site Visit Report. We encourage you to pursue accreditation with the National Commission on Correctional Health Care. We'd like you to consider conducting a study to determine if using a lower clinical opiate withdrawal score would benefit Tarrant County. And lastly, we'd like you to develop roles and responsibilities document for JPS actions at the jail. Others will discuss this in more detail. Over time, we noticed people dying in the jail while in detox protocols. We did a little research and we wrote a letter addressed to the gentleman in charge of the site visit, which is a part of the Department of Justice. We copied the sheriff, the state, Ms. Baugh, and Dr. Badamosi. The letter speaks for itself. I encourage you to read it. I'll just mention a few takeaways. The Department of Justice states, deaths from withdrawal are preventable. Only JPS has anything to do with detox protocols in the jail. When an individual has a clinical opiate withdrawal scale below 8 in Tarrant County Jail, the minimum standards of observation as required by the Texas Commission on Jail Standards remain in effect. These minimal standards only require face-to-face observation once every 60 minutes, but there are provisions to lower that in certain circumstances. The letter goes into more detail and has more points. The Texas Jail Project provided us information on a Pennsylvania study. This group near Philadelphia, whose inmate population consists of 18,000 individuals detained in their city or county jails, is now using a clinical opiate withdrawal scale of 1 after a study showed health benefits for its population. Perhaps a study could tell us if a lower CAL score would benefit Tarrant County. In addition to detox, We are concerned about the last 3 deaths in Tarrant County in 2024 involved persons with diabetes. That's a third of the deaths in '24, and I don't even know if those other individuals who died had diabetic or were diabetic. Is this normal? I don't know. But our next speakers may discuss more of these issues, and we have a family member who contacted the Texas Jail Project, and she'll be speaking. I appreciate your time, and I look forward to meeting with your staff and other members of the board to discuss these issues. Thank you.
Thank you, Ms. Terry. Julie Griffin with the speaking on the National Institute of Corrections recommendations.
Good morning. Thank you for this time to speak to you today. I'm Julie Griffin from the Justice Network of Tarrant County. One of our requests to you is to implement recommendations of the National Institute of Corrections site visit report issued to the Tarrant County Sheriff's Office, JPS, and MHMR. You may or may not have seen this report. It came from a review of medical and mental health care at the Tarrant County Jail and had been contracted for by NIC at the request of the Tarrant County Sheriff's Office. 2 technical advisors from Falcon, Inc. conducted the review over a 3-day period in May 2024. Although the Tarrant County Jail does not have accreditation from the National Commission on Correctional Health Care, that entity's standards are the industry standard, and they were used to measure performance at the Tarrant County Jail. To date, we have heard no affirmative response or intention from TCSO, JPS, or MHMR publicly to follow through on these recommendations. We are here to ask you to proceed with these recommendations, as well as to apply for accreditation from the National Commission on Correctional Health Care. We think numerous of the areas of recommendations are critical in delivering care and prevention of deaths in custody, but the most important one is the structural deficiencies in communication between the 3 entities providing services in the jail, TCSO, JPS, and MHMR. I quote, "The 2-provider dynamic requires establishment and maintenance of a coordinated communication system." And later, it is recommended that standing meetings at all levels between MHMR and JPS be strengthened or established and adhered to as a means of addressing individual cases of concern and coordinating approaches to processes such as suicide watch and reduced food intake. And also, a brief 10-minute multidisciplinary huddle each day before a whiteboard or equivalent review tool in a private location. Attendees should include the medical director, mental health leadership, and others on duty to address current patients of concern and other practice issues. Further, the team found a need for all medical and mental health staff to have adequate access to each other's electronic health records systems. You will be receiving a summary that I prepared of the full recommendations, and I encourage you to read it. We believe in particular those areas that are specific to JPS's role are those in the areas of intake, initial health assessment, acute care, sick call, chronic care, infirmary care, medication services, mortality review. Please do read this summary and move forward with implementation. Thank you very much.
Thank you. Next is Brandy Taylor speaking about, it says jail issue.
Hello, my name is Brandy Taylor. I would like to speak to you all regarding a situation that happened with my daughter. She was incarcerated on 1/30/25. She went in to do something regarding with her probation that her probation officer wanted her to do. It was a weekend jail deal. When Cassidy first arrived at Tarrant County, she brought in her medication. My daughter is a diabetic 1, and so from my understanding, to make sure that we would be covered from the time that she was there until the time that she would leave, we would bring her medication with her name on it, her ID, and that she would be taken care of from the time that she was there, from the time that she was to leave. When Cassidy was brought in, she was brought in with intake, and she was put under the wrong identity to start off with. I called with concern of that because, for one, she's not the same person that we brought her in, and she's also only a 19-year-old. She's 19. And as the time, as the time went on, she got into the intake, and they took her sugar. Her sugar was at 429. I don't not everybody knows about a diabetic 1 and diabetic 2, but with diabetic 1, that's pretty high. She needed to, have insulin, water, and it's a 15-minute rhythm that you have to go, with her having the diabetes 1 to get her sugar back down. She was then brought back to a room which she started to throw up, and she asked for medical attention. When medical attention came down to speak with Cassidy, instead of treating her as a diabetic 1, they treated her as if she was having anxiety. Cassidy continued to throw up, and Cassidy continued to do what you call DKA, and that is when your ketones are, I don't have time to get all into that. I only have 52 more seconds. But Cassidy was left in Tarrant County with no insulin, no water, no food for the 4 days while she was there. When her husband arrived to pick her up, she was passed out on the floor. We had to pick her up and take her to JPS Hospital. Her body temperature was 91, and she was in diabetic coma. And she's home now. So I just wanted to speak to you guys, and hopefully there will be something that is implicated and changed in the system. And that's what I'm here for, and that's what my hopes are. And thank you all very much.
Thank you. Next is Harriet Harrell with the Justice Network recommendations.
Good afternoon. I'm Harriet Harrell, and for years I had an office on this very floor because JPS was a major partner for Leadership Fort Worth during the years that I was executive director. So I have great affection for JPS, and what I want is for its services in the jail to be strong and respected and not scapegoated. Since we began studying jail deaths, we've been concerned about the lack of public written agreements outlining MHMR and jail staff roles in relationship to JPS. MHMR has a contract with the jail clearly detailing staffing, roles, and performance expectations with jail staff. JPS has nothing comparable, leaving you open to blame when things go wrong. For instance, the sheriff's office responded specifically that they have no policies or protocols on detox, and MHMR leadership has told us directly that detox is a medical issue, and they disclaim any responsibility for the deaths that have happened in detox. That leaves JPS holding the ball. If I were you, I would not find that acceptable. JPS must be able to fulfill its mission of care in the jail without barriers or confusion. All staff and the public should know that there are clearly defined roles for all entities in the jail related to the delivery of health care. Therefore, we're specifically asking that JPS, in the leadership meetings with TCSO and MHMR, develop a roles and responsibilities document similar to the appendices in the contract between MHMR and TCSO, clearly defining roles and expectations of all three entities in interactions on medical and mental health issues in the jail. In addition, to recap our other requests, we are asking that JPS implement the suggestions and recommendations from the Critical Incident Response Team's site visit report in May, apply for accreditation with the National Commission on Correctional Health Care, conduct a study to determine if using a lower clinical opiate withdrawal score would be beneficial in Tarrant County jail facilities. And we request to meet with members of the board and staff on pursuing these suggestions to help reduce the deaths in the jail. We have a handout with those recommendations for you so that you will have them in hand. Thank you.
Thank you all. And for the board and for the audience, and I don't know exactly to whom Zelia has met with, but Zelia has met with many of the people who spoke today, and we will, just letting y'all know that there have been discussions. With that, we will move on to approval of the minutes of the joint Board of Managers Finance Planning Investment Committee meeting from January 23rd. Those have been in your portal. Blake is usually my eagle eye and catches something. I don't know if there is. I've got a motion and I've got a second. Any further discussion? All in favor? Aye. All right. Any opposed? Motion passes. Thank you. For board chair report, not too much since we just met what seems like a few days ago. I do want to remind the board that the CEO evaluation was emailed a week or two ago. It is actually due tomorrow. So I respectfully ask that if you could each spend the appropriate amount of time and get that turned in. I was informed by our chairwoman of the committee that she's going to go with what she gets. So if you want your voice heard in that process, please make sure you get that turned in. I also want to announce to the board, as well as some members of staff, a very good friend of mine and physician and a longtime physician at JPS Hospital announces retirement effective February 22nd. Dr. Jay Haynes is going to be leaving JPS Hospital. Dr. Haynes has been a dynamic leader, not only for JPS, but for Acclaim, for our family practice program. He'll be greatly missed here. He's going to enjoy some time off, spending some time with his family. He's my personal physician, and he's a really great one. And so I just wanted to, and I spoke to him about announcing this today, and he was appreciative of that. So Jay's a good man, a good leader for our hospital. We'll miss him, but we do wish him the best. With that, I will turn it over to Dr. Duncan.
Hey. Good afternoon, everyone. Let's see what we have going on here. Okay, we are going to get low. Okay.
Tim's here, so it's not going to work.
I know, you really do. Tim's like, yeah. As we all know, JPS continues to strive for excellence and to be exceptional, fulfilling our mission to transform healthcare delivery in the communities that we serve. Our true north is our patient, and JPS is committed to making every patient experience exceptional, and for that to happen every day at every encounter. But it is important to us that we hear from our patients. We often celebrate internally the great care that we provide, but it is important for us to hear from our patients. And so I just want to share with you a patient quote that we received. Here it says, I want to take a moment to recognize Nurse Elizabeth for her exceptional compassion and attentiveness. She creates such a comforting and reassuring environment, making every patient feel genuinely cared for. The entire staff at JPS Hospital has also been incredible, demonstrating professionalism and dedication by going above and beyond to provide the highest level of care. Their teamwork and positivity have transformed what could have been a challenging experience into one of hope and healing. Thank you all for your kindness and excellence. So I do want to thank our team, especially Nurse Elizabeth, who allows our patients to be seen, to be heard, and to be cared for. Do want to update you on teen birth. I think we have brought this to you before. We have, on January 27th, JPS got loud about the launch of the Teen Birth Initiative. Not only was JPS the first to launch teen birth, but we were the first health system in Texas really to sign on to this program. Just to remind you, teen birth improves communication and teamwork during labor and delivery, so it brings the mom and the family into decision-making at every point during labor and delivery. JPS was honored to welcome Fort Worth Mayor Maddie Parker to our event, who told her own personal story of her adopted daughter who was born here at JPS. And so she truly does know and understand the importance of programs such as Teen Birth and has really supported this. Through our partnership with Teen Birth, we look forward to implementing strategies that will lead to better maternal health outcomes and improve the communication and teamwork during labor for our patients, for our family, and for our babies. This was the event that we held here. Okay, so Medical Home Southwest, it will open up this month. We want to thank everyone who was part of the ribbon cutting ceremony on December 18th. Just to remind you, there will be quite a few services that we will provide there. A large part of it is family medicine. We do have integrated behavioral health, our drive-through pharmacy, specialty clinics, lab, x-ray, ultrasound. Eligibility and enrollment, we will have case management and social work services and patient and community education space. It will be a true comprehensive place for our patients in that community to come to. So we're looking forward to the opening of the Medical Home Southwest. I want to just play a video about our Medical Home Southwest.
We're so excited. This is one of the first of our master facility plan related to our bond program. And so we are helping to inaugurate and cut the ribbon here today for our Medical Home Southwest. We know there's a great need to expand and create more access for services for care. And so this is fantastic because we are bringing this care closer to home for our patients and their families to really make a difference and make it easy for them to access care.
Being able to take care of a patient and all of their needs, from lab, x-ray, their medications, their primary care needs, and then that integration of behavioral health into primary care. And our hopes is to provide that preventative care and that quality care to keep our patients healthy and out of the emergency rooms.
We will be providing child, adolescent, and adult psychiatric services. We'll be providing group therapies, individual counseling, as well as walk-in services for members of the community that feel like they need to be seen urgently.
I've been at South Campus since 2008, so most of my patients say, okay, your guys are moving. Are you going to be still my doctor there? And say, yes, we still will be your doctor there. So I said, I'm really glad that we got a new clinic and we'll be moving there. So that's really exciting for the patients as well.
We have our very distinguished Commissioner Roy Brooks, who we're excited to honor for his passion and effort to help bring this, along with many of our board members and our amazing staff at JPS. And so we're excited to bring this expansion of JPS into this neighborhood to really make a difference for our patients and their families.
JPS Health Network exists to provide health, hope, and healing.
Hey, thank you. We feel this is a great video that we can show out in our community as we go out in our community and speak about the services that we provide. Okay, I think that may end it, but I likewise, as Roger had mentioned, I do want to, and I actually had texted Jay Haynes to come by the board meeting, tends to be a little bit shy, but I do want to recognize Dr. Haynes. For those of you who have not had the opportunity to meet Jay, I can imagine that there's probably not anybody in this room that has not had opportunity to have come in contact with Jay. Dr. Haynes has practiced medicine and served in healthcare leadership in Fort Worth since 1985. He has been the senior medical director for Acclaim, and previously, you may not know this, served as chief medical officer for JPS from 2004 through 2009. He is past president of the Tarrant County Academy of Medicine. He has been actively engaged as teaching faculty and research with JPS and professor and academic liaison with the Burnett School of Medicine at TCU, where he was elected in 2017 to the Accreditation Committee for Quality Improvement. I think everyone knows that Jay has a passion for the patient, our mission, and the quality patient-centered care. He has been a great teacher in addition to a great clinician, and has really made an impact on many individuals' lives. We look forward to Jay spending time with his family, and he enjoys, as many of you may know, making music. I think he's done some performances here around JPS. He has made numerous contributions to JPS, and those will be felt for years to come. And so just really want to thank Dr. Haynes for his service to JPS. Mr. Chairman, that concludes my report.
Thank you. And I just have to say, there's a group of people at this hospital that are never in these videos or in these pictures or in our presentations, because they're the ones taking the pictures and doing the videos, and they do a really, really good job. It's a really good job. So my hat's off to our communications team, because they're fantastic. Thank you. With that, we'll move. We're going to move medical staff appointments and privileges after close. So we'll go to committee reports and action, and we'll talk about the Quality and Patient Safety Committee on January 23rd with Dr. Holland.
Thank you, Chairman. In January we had our Quality Committee, and we always start these meetings with a success story, something to be proud of the work that we do here at JPS. This month we shared a video of a stage 4 lung cancer patient who came to us in stage 4 and who's now cancer-free, which just is a testament to the kind of care that we can provide here. For those who are not medically minded, stage 4 is the worst kind. It's already spread distantly in the body when they're finding it. And so the oncologists here were able to provide this patient immunotherapy to help heal her cancer. Dr. Badamosi, he shared with us an update on the Joint Commission survey results. So after the survey, they had given us a number of things. Didn't prevent them giving us accreditation. However, they had a couple things that they want us to follow up on. They were all concluded and approved on December 20th, 2024. So now we have full Joint Commission accreditation, and it's valid for 36 months. So it's time to start planning on the next one. We next talked about fiscal year 2025 quality priorities, and Dr. Vadamosi, he shared an alignment of compensation with quality initiatives, focusing on the patient experience and the Africa program. The patient experience, he was emphasizing that the patient experience at JPS is more than just data. It's focused on a cultural shift and an organizational reorientation, which involves active leadership, participation, regular rounding, real-time service recovery, and direct feedback to frontline staff. He also shared that we have hired a vice president of patient experience to help coordinate and drive all those efforts. And he gave us a brief update on the Africa program, and that JPS continues to perform really well across most of the metrics that are being measured. We next talked a little bit about the quality dashboard. This is a new initiative that Dr. Badamosi is working. He's not here today. We'll speak about him behind his back. He is developing a quality dashboard, which is basically like all of the different quality programs that are being undergone in the whole system. It's one place to kind of keep account of all of these things. And currently includes 34 metrics, which kind of shows the depth and the breadth of all this data collection that we're using to drive quality. It covers inpatient care, outpatient care, behavioral health, patient safety metrics, and all of the things that we're constantly monitoring and trying to improve consciously and with a coordinated effort. And then kind of to sum up the whole meeting, Dr. Badamosi also shared an update on the Quality Council, so the JPS team that discusses quality on a monthly basis, and he just summed up their November and October meetings, and we discussed Environment of Care Committee, Rehabilitation Services, Care Management, and the Infection Prevention Committee. That is all of my report. Thank you.
Thank you, Dr. Holland. I don't want the board to be tricked. We don't have a whole lot on the agenda because we did it all 2 weeks ago. So I'm not skipping over things, but we have no reports or updates requiring board action. So we will move now to other board discussion, which is consider approval of the district's maternal care program plan resolution. Dr. Carson. Your 4 hours begins now.
That's right. Ages. Well, thank you for the opportunity to present a summary of our inpatient maternal program plan. We will not go over it line by line. But as you know, Tarrant County is rapidly growing, and last fiscal year at JPS, we delivered over 4,700 babies. We are the second highest birthing hospital in Tarrant County. This fiscal year, we're exceeding last year's monthly volumes, and we expect to achieve an even higher number for this fiscal year. Our vision in labor and delivery and in women's health is to improve the patient and family experience, improve the quality and outcomes of population health, and improve access to care. JPS Health Network offers the most comprehensive and integrative obstetrical care model available in Tarrant County. Maternal care is offered at 11 of our outpatient clinics across the region that work in tandem with our flagship inpatient facility here. And in addition to these patients, we also service patients from Carswell Federal Prison for Women, Tarrant County Jail, and Trinity Springs Pavilion, our behavioral health hospital here. We're designated as a level 4 maternal care program in the state of Texas, the highest available. So care is provided for pregnant and postpartum patients from no risk factors to patients with the most complex obstetrical and surgical conditions. We also play a primary role in inbound transport of patients from facilities within our region, and we continue to grow our outreach education programs, which service multiple other hospitals, EMS, and birthing centers. So besides our full complement of obstetricians, maternal fetal medicine specialists, certified nurse midwives, family medicine physicians with fellowship in maternal child health, we also have OB fellowship trained anesthesiologists with their CRNAs, and we do collaborate extensively with our subspecialist colleagues as well. So these include trauma surgeons, intensivist physicians, emergency medicine physicians, behavioral health specialists, just to name a few. We've implemented collaborative case reviews across all of these specialties, and we also conduct multidisciplinary drills. So our delivery care model is patient and family-centered. As Dr. Duncan mentioned, we are the first hospital to implement Team Birth, which is the program that gives the maternal patient and her chosen support person a voice in her care. It enhances communication, as she mentioned, among the care team, and evidence has shown that it can improve outcomes such as better patient experience, increased employee satisfaction, and lower cesarean section rates. Now, other examples of initiatives that we've implemented at JPS to move the needle in lowering maternal morbidity include our participation in the Texas AIM Collaborative to reduce maternal hemorrhage. From the time we started, our patient postpartum hemorrhage rate was over 18%, and we've managed to bring it down last fiscal year to about 10%. So we're very proud of that number. With our hypertensive activity, we know that all patients diagnosed with preeclampsia go home with a free blood pressure cuff and a log so that they know when to come in. They also go home wearing a bracelet that says preeclampsia. So whether they show up here or somewhere else, everybody knows the attention that this patient needs. Last year, we did also form a task force that was comprised of nurses and clinicians that worked to identify factors contributing to our high cesarean section rate in first-time mothers, and we were able to lower that number by 5%, from 28% to 23%. So over the last several years, we've developed a well-structured and robust maternal oversight council that oversees all quality activities and outcomes. So this council reports to the JPS Health Network Quality and Safety Council, which allows for complete transparency of everything that we do. So I'm very proud to partner with all of our nurses and clinician colleagues who are called to this mission of transforming healthcare delivery for the communities we serve. There's no group with more passion in this hospital. So thank you for your time, and we humbly ask for your approval of our plan.
Thank you, Dr. Carson. Anyone have any questions or any comments? It's quite a lengthy report and a bunch of words I don't understand, but it really is. You think about, oh, it's just having a baby, but there's so much more, so much more. And to hear, you said 4,700 babies?
Yes, sir.
That's a lot of babies.
A lot of babies. We're averaging a little bit over 400 a month.
Wow.
So is this an update to a previous plan, or is this all new?
This is an update. Our last plan was about 3 years ago, and we were able to cut it down by about half.
Okay.
Believe it or not.
If you don't mind just giving us an overview of the major changes from the previous plan.
Sure. The main changes is that the Texas Code for maternal levels of care changed the order more than anything of what they provided. They did ask us to update certain programs such as our placenta accreta spectrum disorder plan, and so as well as ED, emergency department, how is the ED handling our patients, and so those were the really biggest updates in the plan.
Okay, great. I'll ask for a motion to approve if there's no other discussion.
Mr. Chair, I had a comment. I wanted to, and I spoke with Dr. Carson Henderson earlier. As I read through this, if you're not a medical person, which describes most of the board, there's a lot of terminology in here that's not familiar to you, that you don't understand. But what came across to me from these pages, and there's like 70 of them, loudly, was the passion that the team that worked on this put into having a maternal care plan that will ensure that JPS has the finest maternal care in Tarrant County, and also one that that's constantly seeking improvement. And Dr. Carson Henderson, correct me if I'm wrong, I think that Jerry Ames was key in this document, and she has more than twice as many letters after her name as she has in her name. I noticed that. But to her and to everyone involved, I just say thank you, because this is a document. This isn't just words. There's so much passion that comes out from reading this, that the team that did this wanted to do a great job, and it reflects so well on JPS. So many thanks to everybody involved.
Yeah, I think Jerry Ames was recently recognized, wasn't she? Okay, yeah. For her work in maternal hypertension. So.
That's great.
If I may. I have to thank Blake, because I read 70 pages and I didn't catch what he caught. On page 54, 57, 59, and 61, accidentally we have included confidentiality language that should not be there. We'll remove that from the plan. The work product of the committees is protected under the confidentiality law, but not the plan itself. So it's just a typo. I think we just added that language, and I think we didn't really take that out, but we'll make that change, but that's the only change, and thank you, Blake, for reading it.
Absolutely.
So those changes aren't in this document, but you will make them upon approval. Okay. I've got a motion to approve, and I've got a second. Any further discussion? All in favor? Aye. Any opposed? Motion passes. Thank you very much. All right, with that, we will adjourn to executive session, as there's no consent agenda items. And we'll give everybody a 5-10 minute break, and then we'll get started.
Okay, I'll go get me something to eat now.
Reconvene in open session with medical privileges to approve, and I'll ask for a motion. Got a motion? And a second. Any further discussion? All in favor? Aye. Any opposed? Motion passes. We stand adjourned at 3:01. Thank you all.